Kaiser Longitudinal Integrated Clerkship here at Kaiser-SF. Basically, it's a longitudinal program where we're introduced to all of the different core specialties, but rather than approaching them in kind of a block fashion as it's traditionally approached, we work with a preceptor in each of those fields over the entire year in parallel.
The spirit of the program is that you're able to connect with patients and get to not only care for them in the single specialty that you happen to be on for your rotation, but you also have the opportunity to work with them in other settings as well.
So I chose KLIC-SF because I really liked the idea of getting able to work with preceptors over a period of time and getting to work with the same patients. That felt really meaningful to me.
Okay. I thought, what an opportunity to be able to spend my third year exploring a different health context. Who knows down the line if I want to be working in academia, maybe at Kaiser, maybe in a private clinic. I just wanted more exposure, and this was an opportunity for that.
I think it's beneficial for multiple reasons. One, it gives us a really good sense of kind of what our patients go through in our day-to-day lives. I think when you see them in the hospital, it's really easy to see them at their sickest, and then you discharge them and you never know what happens. But with this program, it's really nice because you get to see people not only when they're super sick, but you get to call them once those things have resolved, and hopefully you've helped them resolve those problems. And it just gives you a lot of empathy for patients and kind of a view into the fact that we're not treating cases, we're treating individual people just like your own family members, your own friends.
One of the things that stuck out to me is the idea of spaced repetition in your learning. Definitely there's been a lot of times in my life where I've binged and purged knowledge, and I think that since I'm at a point in my career where I want to really establish a good understanding and a good foundation of all of this clinical medicine, I don't want to sort of learn how to tie a knot in January on my surgery rotation and then forget, by the time September rolls around. So then having the spaced repetition of all these different fundamental clinical skills stuck out to me as one of the attractive pieces of the program.
I like being with attendings over the course of the whole year, which means they're really invested in my learning and my skill set. And we get a chance to work with each other over a lot of sessions, and so they know where my skills and medical knowledge are evolving, and they can teach me at the edge of my skill set.
Well, I really have enjoyed my time with my medicine preceptor because he is just really eager to teach. From the very beginning, he put together a syllabus for me and has like a list of topics that he'll cover at each preceptor session that I have with him, and he gives me a chance to first talk about what I've learned, and then he fills in the gaps. And I've always felt like a valued member of the care team when I work with him, which I really appreciate.
I feel like I'm getting kind of like my level, appropriate to my level of learning, instruction every time I step into the clinic. So I appreciate that.
I actually just yesterday had a clinic appointment where I got to see sort of a 2-week well baby exam for a patient that I met the mother of back in January when she was early on in her prenatal care. Yeah. So getting to follow that patient through her pregnancy and then see the kid grow up for the next few months that I'm here has just been a really special experience.
A lot of times you feel as a medical student like you're just maybe like an actor, or you're a prop on the set, but I really felt like I was needed in that encounter. And then when she had her baby, it was unimaginable. It was like, seeing childbirth and then being there and knowing the person beforehand and seeing the reaction of the family afterwards. It was a really special moment.
I remember when I went to the delivery, as I started to introduce myself as the medical student to the nurse to sort of let them know why I was there, the patient interrupted me and said, oh, Marcus is our friend.
So I had a patient in psych clinic who was a young woman and just going through a lot of changes in her life, external stressors. And she was someone that I called pretty regularly, and maybe the third time that I called her, she told me that she really looked forward to my calls and really felt like I was someone she could talk to. And
well, one of the great things about a longitudinal approach to surgery is that I get to meet people in clinic, and then often their surgery is, weeks or months later if it's elective, and then I get to go back and see them in the OR and afterward. So there's a longitudinal dimension that I think is not often present in the traditional surgery rotation that I really like.
So what's great about KLIC is that I feel really taken care of, where there's a lot of thought put into the program. The coordinators of the program really looking out for us and trying to keep all of our learning goals in mind while also creating a good experience for us.
One of the things that maybe I sort of retrospectively look back on, I don't know that I necessarily thought about this going into the program, but you really do get to establish a relationship, not just with your preceptors for each of the specialties, but you really get to know everybody in the hospital since you're rotating through sort of every nook and cranny of the hospital and the clinics. You really start to get recognized by not just the patients that you see in longitudinal follow-up, but you also start to recognize the staff, and most faces become familiar, and you really feel like you're a member of the team that's contributing, and you don't feel necessarily like you're a stranger walking into a team.
So one of the biggest things that I'll take away is the connections I've made with preceptors and with people in the Kaiser community. Also having an understanding of how Kaiser works, I think will help as I move on in my career and see other systems, just to kind of see, to be able to compare some of the benefits of being in this system to what other systems have to offer.
this whole year has been really lovely. There's been so much attention and care placed onto us from the preceptors and Brian with organizing everything. I definitely feel like it's been great getting able to talk about what we want and seeing those changes happen in the program. I've really felt very supported and I'm learning a lot.
Okay.